Well, good morning. Dr. Glenn here with another Monday Morning Motivation. You know, I've been flipping through the last few months worth of topics for these motivational videos, and I realized that we've missed osteoarthritis or arthritis. And it's a shame because it affects a wide number of Canadians. It's the top leading cause of disability in females in Canada, third leading cause of disability in males in Canada. Most of my patients are dealing with it. You may be dealing with arthritis, or at least we know somebody in our family that's dealing with arthritis. And there's some things that we can do to either prevent osteoarthritis altogether or definitely prevent the progression of the condition through the years. So before we get into that, I'd like to have just a general description of what arthritis is. Arthritis is a big umbrella term. So there's lots of different types of arthritis. By far the most common is osteoarthritis. So when everybody says they have arthritis, if they don't specify, usually it's osteoarthritis. Now, depending where it is in the body, it can get even more complicated. Chiropractors usually use the word degeneration. And that just means osteoarthritis in the spinal segments. And not the vertebrae, but it actually happens in the discs. So that's the most common form of arthritis, so that's where we're going to start the discussion. So what causes arthritis? Basically, it's aberrant motion, poor motion over a long period of time allows that joint to degenerate. So the problem is that a disc joint doesn't have vascular supply. There's no blood supply going into it. So it needs that motion to keep nutrients coming in and flush the toxins out. And as long as we're moving all day, that provides that joint with the right nourishment to stay nice and healthy. Now the problem is when we have an injury, and most of us have injured our back for some periods of time, the back seizes up and prevents a healthy motion in order for it to heal, so it's a good thing. But during that time, the joint's not getting the nutrients in that it needs. Or possibly we're just sitting at work for too long, or just moving improperly. There's lots of reasons why this process can start. But a few cartilage cells are going to die off while that joint is immobilized or not moving well. Because a few of the cells have died off, now we're not going to have as much motion at that joint. So because we don't have as much motion, less nutrients are going to come in over time. Over time, that's going to lead to more cell death within that cartilage disc. Because of more cell death, we're going to get less motion, which means less nutrients, which means more cell death, less motion, less nutrients. And you can see that this becomes a progressive issue. So if you follow that process, it's very easy to understand how we stop it. Basically, get motion or get healthy motion in that segment, and it's going to drastically reduce the speed of the progression of osteoarthritis. So how do we do that? How do we treat arthritis if we already have it? Number one, you're talking to a chiropractor, so you can get a little bit of a biased answer here, but chiropractic care has to be one of the best ways to get proper motion into that segment. Now, chiropractic is not enough. We can get the segment moving well, but it's up to you to then go out and do nice spinal hygiene, stretches and exercise and movements through the day to keep it moving well. Same with wrists, thumbs, necks, whatever it is, you have to keep that joint moving. Now you can also supply it with some cellular nutrients, and the top one there for supplementation is glucosamine sulfate. Glucosamine is that big long chain that's kind of in the disc, and it's very sticky and it absorbs lots of water. So the more of that we put in, the more absorption of those nutrients is going to happen into the disc. Now there's always some controversy around glucosamine sulfate, and I promise you that if you're reading good studies based on good quality glucosamine sulfate across the board, it shows very good benefits to degeneration or osteoarthritis. The problem is that it doesn't make you feel better. It's giving that cellular support to the disc, so you can't use an indication of how you're feeling if that product's actually working. Guarantee you a good product is actually helping with arthritis. So that's the top 3 tips I have. If you're dealing with arthritis, get regular chiropractic care every 2 to 4 weeks. Be supplementing with glucosamine sulfate and get out there and move. Hope you enjoyed that discussion this morning. If you know of anybody with osteoarthritis, by all means share the video. If you have any specific questions, Dr. Glenn at rfwellness.ca. Have a wonderful week, and I'll see you next Monday morning.